I am Dr. Agnik, consultant physician and assistant professor, College of Medicine and JNM Hospital, Kolkata. Today we'll discuss what is hypertension, what do you mean by high blood pressure, and how can you control this one. So we all know that the hypertension or high blood pressure is quite prevalent in all of the world as well as in our country also. And what do you mean by this high blood pressure? First, we need to know what do you mean by blood pressure. So our heart pumps blood so that blood goes to different arteries to different organs. So how much amount our heart pumps the blood and what the resistance the different arteries in our body ultimately gives to that blood, these two determines the blood pressure. So in easy word, you can say that the amount of the force that the blood gives to the arterial wall can be determined by this blood pressure. Now, blood pressure is normal or optimal, you can say, if it is less than 120 by 80. Now, what do you mean by this 120 and what do you mean by this 80? Now, this upper part, the 120 is known as the systolic blood pressure and the lower one is known as the diastolic blood pressure. Now, we measure blood pressure by means of an instrument known as the sphygmomanometer. Now, this sphygmomanometer may be aneroid or it may be digital. Most commonly now all advocated that we should use the digital sphygmomanometer. Previously in the sphygmomanometer there is mercury, and how much the mercury rises or falls determines what is the systolic and diastolic blood pressure. So this systolic blood pressure is basically how much amount the blood gives force to the arterial wall when the heart beats, and the diastolic blood pressure is when this blood gives pressure on the arterial wall in between the beats, that is when in the diastole. So systole when our heart beats and the diastole in between the two beats. So the upper level optimal is the 120, lower level optimal is the 80. Nonetheless, there is diurnal variation in the blood pressure. So there may be variation in the morning, there may be variation in the evening, but on an average, it should be less than 120 by 80. But when the blood pressure is greater than 140 systolic blood pressure and greater than 90 diastolic blood pressure for more than one occasions, and if this is persistent, this is known as the hypertension. It is measured by the millimeter of Hg. So the upper part is greater than 140 millimeter of Hg, lower part is greater than 90 millimeter of Hg. Now this hypertension, why it happens? So basically we can classify this hypertension as essential or primary hypertension. In most of the cases, in 90% of the cases, the hypertension is of primary origin. There is no exact reason, but most commonly the sedentary lifestyles, lack of exercise, taking smoking or other different types of the tobacco-based products, our lifestyles, all these family history, all this can give rise to the primary hypertension. And the secondary hypertension occurs when there is some pre-existing diseases, like there may be some thyroid problem, there may be some kidney problem, there may be some heart problem, or maybe some congenital problems. In those cases, it is known as the secondary hypertension. It usually happens in 10% of all the hypertensive patients. Now, what are the risks of the hypertension? Already I have said that our modern lifestyle, with decrease of the exercise, our sedentary lifestyles, taking more processed food, fast food, that is taking less vegetables, less fruits, taking more stress, different types of stressful situations, competitive our environment, all these environmental pollutions, all these ultimately smoking, all these ultimately constellate to give rise to the hypertension. Now, I can first, how we can prevent the hypertension. First one is we should do regular exercise. So exercise is one of the important non-medication management of the hypertension. Everybody should do approximately 30 minutes of the regular physical activity in most days of the week. And this physical activity should consist mostly of the aerobic activity. Like you can just run, you can swim, or there may be brisk walking. All these constitute the aerobic activity. Apart from aerobic activity, you can take also resistance exercises, stretching exercises also. But exercise is very important for prevention and for control of the hypertension. Next thing is our diet. Diet is very important. Most of the cases, we are now deviated from taking the traditional foods to the more processed food or fast food. So more processed food or fast food contains more amount of the sodium, less amount of the potassium, and ultimately that leads to more probability of developing hypertension. And if hypertension is there, more probability of it being not controlled. So the diet may be called, the exact diet may be called as the DASH diet. DASH means dietary intervention to control or stop hypertension. It may be more or less similar to the Mediterranean diet or the balanced food. So we should take the balanced food. That is, it should contain the carbohydrates, proteins, fat, vitamins, and minerals in appropriate amounts. We should take the fats in lesser amounts. The fats should be more of the polyunsaturated fatty acids and monounsaturated fatty acids, and the saturated fat should be less. Preferably, it should be less than 30%. And after the fat, we should take adequate amount of the protein and carbohydrates. Carbohydrates contain different types of the cereals, full grains, legumes. We should take different types of the vegetables, all types of the vegetables, green leafy vegetables, red vegetables. We should take different colored foods. That is, all colored foods should be taken in appropriate amounts every day. So another important thing is we should cut off our sodium. Increased sodium intake is one of the most dangerous factor in increasing our blood pressure. So if we want to control your blood pressure, or if you have already hypertension, you should first cut off the extra salt. Next is you should use less amount of the salt in your cooking materials, cooked items. And the last thing is we should take less amount of the processed food or fast food, because in the traditional foods or raw foods, the sodium is less. When we are processing the foods by different types of the manufacturing processes, ultimately salts are added. So any fast foods, any junk foods, any processed food contain more amount of the sodium, and that is quite deleterious for our health, for our heart health. Another thing is we should take more of potassium. Most of the cases, we are taking more sodium and less potassium in our diet. So we should take different types of the fruits that are quite prevalent in the potassium. And this sodium-potassium balance ultimately maintains the healthy heart. And another most important thing is we should stop smoking. Even the passive smoking or second-hand smoking is very much deleterious to heart health. We should also stop all tobacco-based products, gutkha, khoini, etc. So all the cigarettes, bidi, any tobacco products should be stopped at once. All these increase the blood pressure in very amount. Not only the blood pressure, different other metabolic parameters are also become problematic when the smoking continues. And it has been seen in different studies that if you cut off smoking, that ultimately drastically reduce the chance of the hypertension and hypertension related heart problems. Next thing is we should cut off our stress. So in our environment, in our modern environment, there is lots of stress, lots of competitive environment that ultimately leads to hormonal imbalance and ultimately causes more chances of the hypertension. So if you maintain relief, you should consult any doctors if there is more stressful situations. Next thing is, apart from diet, exercise, and stressful situations, if you have hypertension and you are already on medication, you should consult your doctor regularly to see whether your hypertension is controlled or not. If the hypertension is not controlled, your doctor can change your medication, can increase your medication, and can advise for further tests to find out why it is not controlled. Apart from this, adherence to medication, that is what your doctor writes, with consultation with you that these medications should be continued. You have to continue your medications. Antihypertensive medications have to be taken for lifelong. Nonetheless, the dose may be decreased or increased. The number of medications, the different types of the medications may be changed, but you have to take in most of the cases lifelong. So you should not forget your medications in any ways. You have to take your medications in the right amount, in the right frequency, in the right time of the day. So adherence to the medication is another important thing. So when the hypertension is continuing, you are not controlling your blood pressure, ultimately leads to deleterious effects on different types of the blood vessels, on the heart, on the brain, and different other arteries all over your body. So ultimately, if your blood pressure is not controlled, that ultimately leads to heart failure, can lead to heart failure. Your heart cannot pump adequately, that is those blood that is needed for optimal function of your body. There may be myocardial infarction or heart attack. There may be different types of the other heart problems. Apart from this, there may be cerebrovascular accidents or stroke. So when there is increased blood pressure, there may be stroke in the brain. There may be some peripheral vascular diseases. When your lipid is not controlled, when there is your cholesterol, triglyceride, etc. is also high, that ultimately gives coating on your blood vessels. That is known as the atherosclerosis. And with this increased atherosclerosis, your blood vessels become more narrow. So your heart have to pump more strenuously to pump these bloods to different organs. So ultimately that leads to increased blood pressure also. And this atherosclerosis can be decreased by taking the appropriate diet, by taking regular exercise, by taking the different healthy habits. And if your blood pressure is not controlled, ultimately different organ function can also be compromised. Even the hypertension can lead to blindness also. Now, how you can understand that your blood pressure is increased? In most of the cases, there is no specific symptoms of increased blood pressure. That's why it is also known as the silent killer. In most of the cases, when increased blood pressure is estimated, it has been seen that the blood pressure is increased for many months or years. So ultimately that leads to different organ damage. These organs are already becomes compromised. So you have to check your blood pressure regularly. In every year, you should check at least once or twice with your doctors, or in the home. You can buy the home-based different types of the blood pressure machines, and home-based blood pressure monitoring can also occur. So what happens? The home-based blood pressure monitoring is also preferable now, but because in most of the cases there is one entity is known as the white coat hypertension. That is, you don't have hypertension in the home, but when you goes to the clinic of the doctors, due to the stress, there may be increase of the blood pressure. This is known as the white coat hypertension. Another term is known as the masked hypertension. That is also very, very much problematic, because here you have hypertension in the home, in your normal environment, but when you go to the clinic of your doctor, your blood pressure is not showing high. So all these can be appropriately estimated if we monitor your blood pressure in the homes on different times of the day, in different days. So monitoring blood pressure is very important, and if there is increased blood pressure, you have to consult your doctor immediately. So healthy heart is very essential. You have to take your foods adequately, take your foods in appropriate amounts. You have to cut off your fat amount. You have to take carbohydrates, protein, fats, green leafy vegetables, legumes, whole grains appropriately. You have to sleep well. You have to decrease the stress. You have to take the physical exercise. You have to stop the smoking and all tobacco-based products. You have to cut off your alcohol intake. You have to regularly visit your doctors or consult your doctors. And if you are on medications, you have to take your medications appropriately. Apart from this, you have some other chronic diseases, like if you have diabetes mellitus, if you have some thyroid disease, if you have some kidney disease, if you have some other metabolic problems, dyslipidemia, there is always chances of the hypertension at any point of time. So in these cases also you have to check your parameters regularly. You have to take your medications in consultation with your doctors. And also if there is increased blood pressure, you have to control this. This hypertension and increased blood pressure is very much deleterious, and it causes many morbidity and mortality throughout the world. And in our countries, in our South Asian populations, us Indians are very much prone to hypertension because our metabolic profile is so always there is dyslipidemia, because we are taking the high carbohydrate diet and our lifestyle is quite sedentary. So all this leads to increased cardiovascular load. So increased cardiovascular morbidity and mortality can be decreased if you ultimately take different types of the appropriate healthy behaviors optimally, as well as check your blood pressures regularly. And if there is hypertension, there is different types of the medications, and you have to consult your doctor, and accordingly the medications you have to take regularly to control your blood pressure. So healthy heart, we all need healthy heart. So healthy habits, we have to inquire healthy habit, we have to follow, and ultimately that can lead to healthy heart, and we can life, our quality of the life will be improved if we follow all these. Thank you all.